Good evening and welcome to the MIU Men's Health Foundation Prostate Cancer Survivorship Series. We're actually very excited to hold this event this evening, and I think that you will find this very worthwhile. Tonight is about sexuality after prostate cancer, a new beginning. And this is a very important session that I hope that you'll find very valuable. And we actually have two great panelists to actually share their expertise and make this an excellent night for everybody. Our foundation is very proud to have the Survivorship Series. It dates back to 2009 since the inception of the MIU Men's Health Foundation. And if you wish to see more episodes like this that are relating to prostate cancer survivorship, I would recommend that you go visit our YouTube website. And on our YouTube channel, we have all of them archived and available to you for your perusal. I want to thank to our sponsors, Blue Earth Diagnostics, Neil King Physical Therapy, Trinity Health, Beaumont Health, as part of WellCore, Barbara Ann Camano's Cancer Institute, and of course, our perennial partner, the American Cancer Society. You know, every year we hold many events through our foundation, many of them through the month of June and as well in the fall. And our fall event is our men's health event, which we hold annually at the Ford Field. And this year we had almost 700 screenings, and we provided over 6,000 screenings to our individuals who attended the event. One of the things that we do find at our event very commonly are men with elevated PSAs. And this year, almost 30% of our attendees had elevated PSAs. And I can tell you that well over half a dozen men every year will tell me, as they catch me in the hallway at Ford Field, that their lives were saved at our men's health event, that their prostate cancers were diagnosed, and that throughout the year they received their treatments and everything that they needed to move on after their diagnosis. And so we're very proud of our annual men's health event, and we hope that you'll stay tuned and follow us throughout the year and participate in our annual men's health event that we hold each and every year at Ford Field. I'd like to talk a little bit about our panelists who are standing by. First is Courtney McCracken. She is a nurse practitioner at the Michigan Institute of Urology. And as well, she is the owner and founder of M.S.N. Courtney, I'd like you to maybe talk a little bit about yourself, your training, your background, and kind of your links into sexuality and prostate cancer survivorship.
Sure. Thank you, Dr. Lutz, for having me. And thank you to the Men's Health Foundation for everything you guys do. It's fantastic. Hello, Dr. Sandberg. Nice to see you again.
Hello.
So my name is Courtney McCracken. I'm a nurse practitioner, and I've been with Michigan Institute of Urology for 6.5 years now, which blows my mind. Within those years, I started my own company called M.S.N. At M.S.N, I provide aesthetics such as Botox, dermal fillers, and I also introduce sexual wellness procedures to the practice to help everyone with their sexual wellness. I have been doing that for a little over 3 years now, and it's just a very rewarding field. I love helping people and bringing my urologic expertise to my own business. So it's been a lot of fun. I've learned a lot through the time I've been there, and I'm still learning every day. So we do see a lot of people from the office that do have some sexual wellness issues or whatnot. So bringing, like I said, my expertise to my business is very rewarding.
And just out of curiosity, how does M.S.N play a role in general for some of the sexual healing that some of these men actually need?
Yeah, so we provide services such as PRP, so platelet-rich plasma rejuvenation for the penis in order to help regain some sexual function, especially after some of these procedures, such as whether or not they've had cancer treatments such as radiation or surgery. A lot of these procedures help rebuild and regrow some of the lost like blood vessels, and having that rebuilt offers more advancement in getting erections for men. We also do there's so many things to do with PRP, but in general, just at M.S.N, we do provide those services, such as on label it's called the P shot, but we call it the PRP, penile rejuvenation shot.
Well, I think we'll get into that probably in a little bit along the way and talk
Yeah,
about the P shot and the O shot for you,
yeah.
because I think that people want to learn a little bit more. Dr. Jason Sandberg is a partner, which I'm very excited to say, at the Michigan Institute of Urology, and he's fellowship trained in reconstructive urology. Talk a little bit about what your training in reconstructive urology is all about, and your role in prostate cancer survivorship as well as sexual health.
Sure. And thanks again, Dr. Lutz. I really appreciate the opportunity to be able to speak to so many people through this avenue today. As Dr. Lutz said, I'm one of the younger partners in the practice. I've been with the practice now for about almost 2.5 years, and did come in with some fellowship training in reconstructive urology. What that means is that we do some specialized training in patients with all sorts of different urologic issues, particularly the lower urinary tract, including urethral stricture disease, but also in prosthetics and being able to help give men function back that they may have lost as a result of prostate cancer and some of the treatments that men go through. So in particular, I'm an expert in helping guide men through issues related to erectile dysfunction and stress urinary incontinence that may arise after either prostate cancer treatment from radical prostatectomy or radiation or cryotherapy, both medically and surgically. And one of the big roles that we have in treating men with what I would call like end stage erectile dysfunction, or patients in whom they tried other medical therapies and aren't working, is surgical implantation of penile prosthetics to help restore erectile function that gives men the ability to become sexually active again when they might not be able to currently.
You know, we're always looking for ways to improve on things that we already do. And in the last few years, shockwave therapy, such as Duolith, which is available through the Michigan Institute of Urology, in comparison to Gainswave, which is out in the community, exists to improve the blood flow to the penis. Can you talk a little bit about Duolith and Gainswave, some of the differences and why we use Duolith and how it can be efficacious for men who are looking for something other than just taking oral medications?
Yeah, absolutely. So the idea behind these treatments in general is relatively low intensity shockwave therapies delivered to the nerves and the blood vessels within the penis that we believe are responsible for erectile function. And with repetitive treatment and stimulations through these treatments, there's been evidence to suggest that you have increased blood flow, increased or vascular dilation, and increase in erectile strength and function with these treatments. In general, men who choose to have Duolith with our practice will go through a series of treatments, typically 6 sessions to begin with, sometimes more in addition to that, that they come into the office, they have a 20 to 30 minute session where this procedure is performed, not painful, relatively easy to undergo, and does not require any sort of invasive therapies, no needles, no injections, nothing like that. So that's one benefit compared to some of the other options that still will work good for men, but in some cases, we have patients with needle phobias, for example, and they don't want to do injections for erectile medications or PRP or whatever it may be. With the Duolith procedure in general, we think that this is one of the better options out there in terms of, Duolith versus Gainswave in the community, because of the actual machine and the module that we use, with deeper penetration of the ultrasound waves into the penis, which we think is going to get you better results with that. And so it's certainly an option that I talk to my patients about, amongst the gamut of all the options for erectile dysfunction treatment.
Talking about sexuality has never been an easy thing. And I can tell you that many men, especially once diagnosed with prostate cancer, decide not to share it with anybody or not to talk about it, mainly because of the connotation that there may be some sexual side effects and they don't want people to talk about it. Since the advent of Viagra back in the 1990s, the environment socially has actually changed, and sexuality has come out of the closet where people are willing to talk about anything. There's no question. You can look at some of the first TV commercials that, when Levitra, which was one of the first PDE5 inhibitors, came out, around the same time as Viagra, and they showed a man throwing a football through a tire. Nobody really got it or understood what that meant. They thought it was an arthritis commercial. Nobody really knew what Levitra was, but it really was one of the first medications to improve erectile function. And all of these things have been coming out where there's now all these commercials and conversations and discussions about sexuality now in the open, which heretofore were not back in the 1990s and the early 2000s. Men have become way more open to discussions, and that's why we have this discussion tonight to talk about sexuality. The other thing is there's increased resources. The internet has been a great resource, and Dr. Google, which is used by so many people to improve their medical training and medical background. And I can be honest that I also do use Dr. Google whenever I have something that I don't understand or am aware of. Physicians in general are becoming more and more aware and attuned to the psychological and sexual needs of their patients as part of their overall recovery and sense of wellness. And that is what has prompted us to look at the development and integration of men's health clinics, not just for men in general, but for prostate cancer survivorship. So we know that there's clinics all over the community that are popping up, similar to Moxie and others, and some that may not even come close to the level of what Courtney is able to offer through a clinic such as Moxie, that are just giving testosterone shots for men who have low libido. But we believe that full service men's health clinics, as they come into the community in partnership with organizations like the Michigan Institute of Urology, will serve a great purpose to kind of like bridge that gap in services that people need out in our community, whether they're prostate cancer survivors or otherwise. The goal of all of this is to destigmatize sexuality and make it more approachable. And that's part of what we want to do tonight. So with that being said, I'd like to start with a few questions. And if any of you who are watching right now have some questions, you can feel free to send them on through the chat line. And you can send them to us. If they can't come through the chat line, you can send them through Messenger to our foundation site, and we'll record them from there and make sure we talk about them tonight. So the first question is to Dr. Jason Sandberg. And the question is why does the treatment for prostate cancer in general place male erectile function at risk?
Sure. So the short answer to that question is the sort of machinery, the plumbing, if you will, that's responsible for erectile function is near the prostate. And so namely, we're talking about nerves and blood vessels that are responsible for erection, run right along the lateral and kind of posterior backside surface of the prostate. And oftentimes, intentionally or otherwise, oftentimes intentionally due to, the desire for excellent cancer control, when a prostate is removed, for example, those blood vessels and nerves can be damaged. The same thing can be true of radiation therapy, of cryotherapy or freezing, or of heat therapy that some men undergo for prostate cancer. And so, oftentimes the side effect of prostate cancer treatment in order to cure the disease or get control of the disease optimally is going to result in erectile function dysfunction.
So there is data that shows that men, as they get older, will suffer from erectile dysfunction in and of itself, not even as part of prostate cancer survivorship. What is the general incidence of erectile dysfunction as men age? And what are some of the comorbidities? When we see a man who comes in the office, what are some of the risk factors for making their erectile dysfunction worse and may even play a causal role?
Sure. So, the incidence of erectile dysfunction is large. And I tell all the men that I see exactly that, because as you mentioned, there is an evolving conversation and willingness to talk about it. But, there are still plenty of men who are not discussing this with their friends, their family, and even their wives and girlfriends. And so the first thing I do is I tell them, hey, this is a very common condition. Studies suggest that 25% of all men at some point will have erectile dysfunction in their life. And when you take men above the age of 40, that number is above 50%. And when you take the men who have had prostate cancer treatment, it's even higher. And so when you take all of that together, a very, very common condition. Then when we're evaluating men for erectile dysfunction, with or without a history of prostate cancer or treatment for prostate cancer, we do have to look at their other medical history. So things like diabetes, heart disease, high blood pressure and blood pressure medications, other medications that men might be taking for various reasons could be causing erectile dysfunction. Other types of non-urologic surgeries or conditions that patients might have been treated for example, colon and rectal cancer may result in erectile dysfunction. And so, there's a whole wide variety of of potential causes and contributors. And oftentimes treatment will be, or the treatment pathway ultimately will be decided based on in some part, what those things might be contributing.
You know, a lot of times when I see men in the office, one of the things I talk about is waist circumference. And I allude to waist circumference as kind of like, the holy grail for health. And that the more appropriate your waist circumference is, the better the chance of overall survivorship of everything, whether it's the risk of getting prostate cancer, urinary symptomatology, erectile function, maintaining normal testosterone levels. They're all linked to waist circumference because it's that fat within the abdominal area, that visceral fat, as we talk about it, it increases the risk of all of those things going south. And so I always tell guys, you want your waist circumference to be half of your height or less. So if anybody is listening to this, you can do some quick measurements. As a 6 foot tall man should have a 36-inch waist, and you can do all the calculations thereafter. So it should be between 0.4 and 0.5 of your height. And if you're thinking about doing something positive about your life, the best thing you can do is get your waist circumference in the right range, because I can tell you that over 70% of the men who attend our men's health event have abnormal waist to height ratios, and at least half of them have morbid obesity. So it's really important to do something about that. I also want to know, Jason, when you counsel men who are diagnosed with prostate cancer, the discussion of sexuality is oftentimes the elephant in the room. A lot of times nobody wants to talk about it, or the issue is not even broached. So how do you oftentimes broach the discussion, and how do you create one of those active listening type dialogues where you can have a really good conversation? And is the spouse usually there, or the significant other, or do you try and do it alone, or do you have a special session with the patient and their partner in the room?
Sure. Yeah. So, I mean, I think first of all, I'd say that it really is, to your point, sometimes the discussion around sexual function and possible dysfunction after prostate cancer is often overlooked, because rightfully so, the man is concerned about the fact that he has cancer, and his laser focus is on, how do I treat this and how do I cure it? And so then oftentimes I'll end up seeing a man after the fact, and they say, okay, I'm through that. Now what can I do? And of course, I always say, well, it'd be great if we could try to talk about these things before surgery. And when I do have that opportunity with men, I do tend to tell people that while not all men will end up with sexual dysfunction, I often kind of ask them to, prepare for the worst and hope for the best, just because it is oftentimes something that we have to deal with after the fact. The inclusion of a spouse or significant other in the conversation, I think, is very, very important. And I think in a lot of ways, I'll kind of contradict myself and say sometimes it's the most important thing and sometimes it's not so important. And by that, I mean, certainly sexual practices, two people oftentimes are involved, and that spouse, your goals, for sexual restoration, sexual practices, what their sort of interest is, definitely plays a role. But at the same time, sexual function and potential restoration of that function is a very important thing for a lot of men in terms of how they see themselves, for their self-esteem. And a lot of guys tell me, I just want to feel like a man again. So I've treated many men in whom are not actually currently sexually active with their wife or another partner, but they're interested in these therapies so that they have the confidence to be able to pursue that if and when they might choose to do so. But anytime a man is in a relationship with a partner they trust, I always invite them in for the conversation, because oftentimes the man is there and has great questions, and other times he's kind of sitting in the corner and his wife might be asking all the questions that he wants to ask but may not quite be there. So I try to create a safe environment, inclusive environment, and also let them know that, hey, I know that you're not used to talking about this stuff, but I assure you that there are many, many guys just like you that are going through it. And sometimes it takes a few visits to really get through it fully, but we can always get there with them eventually.
Thank you. There are a lot of questions coming in, and we'll be addressing them along the way. So if you stay on for the entire meeting, I can guarantee we will be getting to all of them. And I know that there are people who definitely are not in favor of going to the direction of having penile implants and want to skip that as an option, and are looking for anything else that might be available. And so we will talk about some of those other options. And no matter how far you are after prostate cancer surgery, you can always be seen for evaluation to rehabilitate your sexual function and become sexually functional again. With regards to the role of testosterone therapy and prostate cancer, I'll get into that at the end and refer to one of the podcasts that I recorded earlier this year with Dr. Ananias Diokano, the former chief of urology at Beaumont Hospital. And there's an entire podcast that's all about testosterone and its relationship to prostate cancer and overall role of testosterone in male health. Courtney, I wanted to ask you something that, oftentimes men in our practice are referred to you after treatment has been completed. Do you think there's a role that, number one, you should be seeing some of the patients before they have interventional therapies? And number two, what and how do you intervene for the steps of sexual recovery after a man has been treated for his prostate cancer?
So, it's always good to educate your patients. As a nurse practitioner, that's one of our biggest goals. We like to educate, and especially prior to any procedures. They do see us in the office, we do see them in the hospitals, and we try to come up with an agenda for them so they know what to expect moving forward. And like what Dr. Sandberg says, expect the worst, hope for the best. We try not to give, we want realistic expectations about, the process moving forward. And one great thing about us is that we're here to talk, we're here to listen. Being a part of, what I do at MOXIE and having that ability to provide these injections, they not only, they're not medicated. So there's no medication in them. It's your own blood that's re-injected into the penis. So it's not a harmful injection at all. So to provide them before a procedure or to comply with, following up after the procedure, either way, I would say would be beneficial to the patient. It's only going to benefit them either way. And then, at the, when we see them post-op, typically it's more about compliance after too. They have to understand that it's a journey, more of a marathon, not a sprint. And then we work with them to get them to where they, feel comfortable being and feeling, as Dr. Sandberg said, like feeling like a man again, or just being comfortable in their own skin with their spouses and whatnot too.
Sounds great. Thank you. Jason, PDE5 inhibitors have been around for quite a while, which is Viagra, Cialis, Levitra, and Stendra. And they've been around for a while, not necessarily all at the same time, but now they're all available. And many of them now are available as generic, so they're very cost effective. What do you think is the role of those in the pre or the post-treatment setting, and how and when do you usually use them for men in the recovery phase?
Yeah, sure. So I think, these are often what I think of as some of the first line therapies, for erectile dysfunction. And the reason being that, like you said, now relatively cost effective, relatively, effective, and also relatively minimal side effects. Now, it is important to note there's some men who may not qualify for use of these based on other medical conditions. But in general, I use these when I'm seeing a man after prostate cancer treatment, or even a man who hasn't had prostate cancer and has erectile dysfunction. I'll use these as first-line therapy to try to see if they'll help, because oftentimes they're very useful. In men who have had prostate cancer treatment, particularly radical prostatectomy, we'll oftentimes start men on oral PDE5 inhibitors on a regular basis following surgery, and sometimes even before surgery, as part of a penile rehabilitation pathway, in order to help promote blood flow to the area down to the penis on a regular basis, even when a man may not be sexually active and is recovering from radical prostatectomy. And in a lot of cases, this has been shown to be effective in trying to help regain sexual function earlier and sooner after radical prostatectomy, and be effective in helping them and get back to where they want to be initially. But it is also important to note that if these pills are not effective, that there are several other treatments for prostate cancer, for erectile dysfunction, that men can then move on to.
Do you think there's a difference, Jason, in the efficacy of these drugs from one to the other?
I think it's kind of a hard question to answer in my mind. I mean, there are certainly, I see variability between men, I would say, in practice more than anything, in terms of For one man, Viagra might work, whereas another one, Cialis, works better. One thing that I often find with Viagra, for example, is men may not be properly educated on how to take it. It's most effective on an empty stomach, for example. And if you take it with a big meal, it won't get absorbed and won't be very effective. And so for those reasons, sometimes Cialis is a better option, or just re-education. But in general, I will oftentimes try a man on 2 or 3 different versions of these pills, or kind of combinations before moving on to another therapy, just because there is so much variability.
How do you counsel men when they come in and they say, instead of 100 milligrams of Viagra, I took 200 milligrams and that actually works for me? Is that okay?
Well, I always recommend to take only the recommended maximum dose. And the reason for that is that at a certain threshold, the receptors that these medications are working on a molecular level are saturated. They're basically getting all the drug that they can handle. And all we're doing at that point is essentially increasing risk for side effects, for dangerous drops in blood pressure, for heart attack, and things like that. So I don't personally recommend taking those medications at higher doses than recommended.
Thanks. Appreciate that. I get asked that all the time.
Yeah.
So another question I have for you, Jason, before we go back to Courtney, I just want to know, do you think there's any role for counseling or psychological evaluation of patients in the pretreatment setting?
I think there definitely is a role. Now, I say that with a focus on individuality there, because I speak to plenty of men who I think have a very solid understanding of, because of possible prior experience with other family members or with friends, of what they might expect in the future. After answering all questions, they have a solid footing. But I have other men who have additional questions and have anxieties about this, which is perfectly normal and natural. And sometimes speaking to a therapist, someone who may or may not even specialize in sexual health, which we do have available, can be useful for men to help frame the issues that they're having in the context of the battle against prostate cancer.
Thanks. So, Courtney, a lot of times, men, particularly after treatment for prostate cancer, the PDE5 inhibitors, Viagra, Levitra, and Cialis, they just don't work. They just don't do the trick, and they don't give adequate erections or allow them to feel a sense of being functional. What are some of the next steps that are available for men, and how can you help facilitate that?
Sure. So when I see these gentlemen, basically at this point, we're at the point of discussing doing the PRP rejuvenation shot. Along with the PRP rejuvenation shot for the penis comes, you have to use actually a vacuum pump in accordance to, the regimen that we supply for you. So depending on how many shots are indicated, we have to make sure that you are committed to working with us and stay on track, and actually, do what we say. But it's a matter of just being able to speak to us, like contact us if you have any questions, or basically just be upfront, and we'll help counsel you in a sense of what our thoughts are. Is it working? Should we try something else? Should we add something else? There are so many new studies coming out, so many different interventions. There are other procedures to help regain the pelvic floor. And then they're talking about, I was just on my Moxie page, and people are talking about, different treatments for with Botox in the penis too. So there's many studies coming out, and that's why we always stay up on our education and knowing like the newest and greatest steps to take, for you and to help you in your quality of life.
I'm beginning to think Botox can be used for almost everything. So
it's everything.
It's almost like the wonder drug.
It is.
So, Jason, your area of expertise is reconstructive urology, and you initially talked a little bit about penile prosthetics. How have they changed in the last 25 years? And what are some of the advantages that men can hope to achieve by going down the road of a penile implant? Because I know a lot of men are very reticent. We just had somebody send in a question literally just a few minutes ago and said, I am not interested in an implant. And I don't know whether they're not interested because they don't know all about them, or whether they don't understand them, or maybe they have a right to definitely not be interested. But I think that it warrants a conversation. How do you think people should get included in a conversation to move forward and to have
Sure.
at least get educated?
Yeah, I think education is the key, and it's very often that I'll see a patient that a partner of mine sends to me, after they've had prostate cancer treatment, and we talk about all the options, and maybe it's the third or fourth time I'm seeing them and nothing's working. And, we talk about the penile prosthesis, and, that man is still not ready to move forward with that. And that's okay. I would say probably the majority of men I see will not progress to getting a penile prosthesis. But my job, I think, is to provide the information so that they understand the option. Because it's may not be in the cards for some men. They might say, hey, I'm such, this is my life circumstances, this is where I'm at. And that, sexuality was a part of my life previously. In terms of, penetrative intercourse, other men are still sexually active, even without full erections for penetrative intercourse in other ways. And they're satisfied in that. But with men, or in men in whom are searching to kind of regain full function, and the other options haven't worked, the penile prosthesis is excellent. Many men are surprised to find out it's been around for over 45 years now. And as you said, in the past 20 to 25 years, there have been some advancements, including advanced antimicrobial coatings to really reduce infection risk to now less than 1% in implantable devices. There are different size devices. There are different kinds of devices, 3-piece devices, which include pumps, reservoirs filled with fluid, and the ability to inflate and deflate a device. There are semi-rigid devices that don't inflate and deflate, which are better for men with maybe who don't have the hand dexterity to be able to, actuate a pump in the scrotum. But I think it's important for men to know that option is out there, because I've also seen many men who have been resistant to it initially, and then we do put an implant in and they say, man, I wish I would have done this sooner. This has really changed my life for the better, and I'm really, really satisfied with where things are at now.
And I think that's pretty typical of a lot of patients is that if they had known the advantages and been educated, that they may have made that decision sooner and would have had a longer time to have been happy with the outcomes. And
right.
So I think that that's important. Courtney, somebody asked a question about platelet-rich plasma shots, the P shot, as you talked about. How do they work? And do you have any opinions on the role of L-arginine for erectile function?
L-arginine, I'm not too familiar with. Unfortunately, I will look into that though. But as far as the platelet-rich plasma, so basically your blood is drawn and it's spun in a machine to separate the red blood cells from the plasma. It's then that plasma is re-injected into the penis in certain areas. And what it does, that the PRP has multiple growth factors, so it rebuilds and restores some of those blood vessels that were damaged, or or like I said, damaged throughout the process of the treatments, or just from erectile dysfunction in general. And the treatments, typically I do a series of 3 treatments, 1 month apart. And in between those treatments, my clients use a penis pump twice a day for 10 minutes. So when I say that there's a full regimen to do these procedures, there's, we have to stick with in order to get the best results. That's pretty much the process throughout the whole thing. So those that have done it have seen great success with it, and very happy with just feeling like themselves again. So it's been a good product to bring into Moxie.
So Jason, there's a number of different compounds we use for penile injection therapy, or intracavernosal injection therapy, as it can be called. One of the individuals asked a question about what's the maximum amount of cc's per trimix. I know there's a number of mixes. Can you kind of comment on some of the different combinations and why there may be maximum doses with some of them?
Yeah, sure. So just kind of on a basic level, there's kind of 4, or I should say 3 main sort of mixes, and then you can have a single drug injected as well, which is marketed under the name Edex or Alprostadil. So that would be a single drug injection that can be done. There's also bimix, there's trimix, and there's quad mix. And as the name suggests, it with each of those, you're adding an additional drug to the mix. Those drugs are alprostadil, phentolamine, papaverin, and atropine. And those 4 medications are all known to dilate blood vessels and basically cause erectile function. Now, as far as the maximum dose goes, typically what we do is we prescribe these medications in units, and you'll get a specific syringe that is a number of units rather than milliliters per se. But the vial typically that comes in is 10 milliliters with 200 units in it. So whether or not you dose it by milliliters or units doesn't really make that big of a difference. But maximum dose is a big deal because one of the biggest risks of taking too high of a dose is priapism with injections. And priapism is a condition where an erection can last for more than 4 hours. It can become painful. And essentially what happens is it traps blood inside the penis. It doesn't allow blood to cycle through, and the blood flow becomes deoxygenated and can cause death to the erectile tissues if it goes untreated. And so we oftentimes will not, I don't like to recommend more than a maximum dose of somewhere in the range of 20 to 25 units, although I have some men who are doing 30 to 40 units depending on the exact mixture they're on, just because above that, again, we're in a situation where we risk, serious side effects without much benefit.
It's a mixed bag about the role of testosterone in prostate cancer. I was just wondering if you could talk a little bit about some of the theories on safety of testosterone in prostate cancer, and does it have any issue with causing the PSA to increase in some patients or others?
Sure. Yeah. So I think, a lot of this comes from the idea that, as some men know, in advanced prostate cancer, we treat prostate cancer by hormone therapy in some cases, which the idea behind that is to drop testosterone levels down to a castrate level, meaning we're trying to just completely cut down testosterone. And so then the logical question follows, well, if I've got a history of prostate cancer and you treat prostate cancer by dropping testosterone, does giving me back testosterone, do anything? And, the way that I answer that question is, well, all men have testosterone. And so in general, what we try to do is restore normal physiologic levels of testosterone. And in general, that has been shown to be safe in men with a history of treated prostate cancer without an increased risk for progression or recurrence. However, we do sometimes see an increase in the PSA with testosterone levels that will then come down if we back off on testosterone doses. That doesn't necessarily correspond to an increased risk of prostate cancer or recurrence of prostate cancer, but it's simply a lab, an increase in the PSA as we're detecting in the lab. With that said, for very, very high risk prostate cancers or prostate cancer that are actively being treated, I don't recommend testosterone replacement at that time, but it's something that can be pursued down the road once the cancer has been adequately treated. I don't know if you've had different experience or opinion about that, but it is a topic of some controversy in a lot of ways.
It is controversial, and I have to say that I would recommend a lot of people, if you have a moment. We started a podcast series called On Call for Men's Health, and one of my interviewees is Dr. Ananias Diokino, and he has just published a landmark article on the role of testosterone in men's health. And he and I both agree about one thing in particular, is that men who have low testosterone are likely to increase risk for prostate cancer. And I think that all men should be aware of their testosterone levels starting as young adult males and should be monitored. And if you have a low testosterone, you might want to be watched a little bit more closely for the subsequent risk of getting prostate cancer. The question that we are unable to answer at this point is, if you normalize their testosterone, will you reduce their risk back to baseline?
Right.
Don't know that one. And so that, I hope, answers the question for one of the individuals. Another question that did come up was about being on hormone therapy for prostate cancer, and I can easily answer this one. The question is that I'm currently on hormone therapy and after prostate removal, but my PSA keeps popping up. What can be recommended? Well, if your PSA is going up every time you stop hormone therapy, that is of significant concern. And number two is, if it's popping up while on hormone therapy, it's even more of a concern. And you should have a discussion about the fact that you may be becoming hormone resistant, which does occur in a number of men who are on long-term hormone therapy. And you might need other types of additional therapy to keep your PSA and or prostate cancer in check. and they might want to do a PSMA scan to determine the status of your disease. So those would be two very worthwhile things to have as a discussion with your treating physician. One of the other questions I wanted to ask both of you is what you think will be the future in the treatment of male sexuality. You know, everything isn't always intercourse, and sexuality is much larger than that. So what do you think, aside from just prostate cancer survivorship, what do you think will be the future in the treatment of sexuality? And I'll have Courtney go first, since we haven't heard a whole lot out of you in the last few minutes, and we've let you rest while Jason was being tortured by me. So what are your thoughts, Courtney, on the future of male sexuality?
I think so. Obviously, we spoke about this before, just in general, it's just such a taboo subject. And I feel that now, like you said, now people are getting more comfortable talking about it and doing more research on it. And hopefully, my thoughts, obviously there's medications, there's, procedures, there's a lot of things that can, we can do and research and, find the best, newest stuff out there. But for me, even like with the therapy, the sex therapy, speaking about it, recognizing it, and actually like moving forward with it, that's going to be the biggest thing for us, and actually like being proactive about it too. So whether it's, like I said, procedures or whatnot, or, it's just being able to recognize it and to, talk to your spouse or your significant other about, what you guys can do together, or, talk to your urologist or, come see me at Moxie about it. There's so many people that can just discuss it and guide you. And you're not alone during this process. Like, we're here for you. We can help guide you. We'll be with you every step of the way. So just knowing that, more of the educational background, the process of, what it is, how it is, and, what it can be, that's going to be, more on the physiological side of things too. So.
Thank you very much. And Jason?
Yeah, so I think, first of all, from a prostate cancer standpoint, I think one of the big things that's going to be have an effect in the future is just changing prostate cancer therapies and changing some evolving thoughts about how we think about prostate cancer in general. I think we're already in a realm where certain prostate cancers, lower risk prostate cancers, we're treating fewer of those men, and we're taking more of an active surveillance approach so that we're not subjecting them to such treatments that might cause erectile issues. And then there's other prostate cancer therapies that are coming down the pike as well that may be more localized, more targeted, more effective with fewer side effects. But I think as far as male sexuality goes, I think we're already seeing a bit of a revolution in terms of the space of social media. And this broadcast, this live stream is testament to that. But in addition to that, sharing stories and building communities online through social media, feeling more comfortable discussing it, and bringing it out into the open a little bit more. I think, that's going to be sort of the future of where we go. We've also seen companies on the internet pop up, like For Hims, for example, who are providing medications for erectile dysfunction and things like that. And I think, it's going to be important for us as healthcare providers to recognize that that's happening, and to work alongside our patients who are seeking treatment both outside of our clinics, but within them at the same time, which is the sort of the necessary reality to help our patients achieve the goals that they want to in a safe and effective manner. And so, it's hard to say what things will look like 20 or 30 years from now, but I'm excited to know that I'm going to be around here for it, and hopefully we'll be doing different things 20 and 30 years from now than we are today. It means we're making progress.
Well, the nice thing is that you will both be part of the next 25 years and what it will be, and you'll be part of the creation of that and what it should be and will be. I've watched a lot of changes in my 37 years of career, and one of the things that I've really enjoyed is seeing how we look at not diseases as standalone issues, but we look at them as part of the whole, and we look at things in a multidisciplinary way. And more times now, we're looking at the thought of prostate cancer survivorship as men's health and men's health survivorship. And that's becoming integral with men's health clinics. And the role of a men's health clinic should give us that psychological counseling pre and post-op, pre and post therapy, role sexual therapy, overall physical health, mental health. Just today, there was an article that was published about the increased incidence of anxiety, depression in prostate cancer survivors. And we know that there's over 3 million prostate cancer survivors here in the United States. So all of these people who are watching tonight and or others that haven't taken advantage of the services that we provide need to know that they're not alone, and that mental health is one of the very important things about overall survivorship. And it's important that that services be available so that you can be the best self that you can be. And I know that it's meetings like this that actually help actually add that dimension of support to individuals who need added services for survivorship. And so I'd like to thank both of you for what you do. I know I work with you and I appreciate you. It's great to have you as partners and working together and taking care of our patients together. So this is a great night, and thank you for volunteering for being here tonight and being part of another prostate cancer survivorship series. And I hope that people who are listening in and watching learn something, gain something, and if anything, had a sense of reassurance that they're moving in the right direction and know that there's an opportunity for something that they might need. If you wish to have other topics covered through our prostate cancer survivorship series, you can feel free to contact us at info@miumenshealthfoundation.org. And we will be more than happy to look at those topics and see what we can do to make them happen. As well, in any of your donations to the foundation, whether they're specific to our survivorship series, our Blue Fund, or any of our other events, or to Fund Demand to help the screenings that we do at Ford Field, they're always appreciated and allow us to continue to offer the services that we continue to provide. I also would like to refer you to our On Call for Men's Health podcast series. It's available on Spotify, Pandora, iHeart, and others, and you can go directly to our website where you can access them directly. As you know, I mentioned earlier about Dr. Ananias Diokino and his testosterone discussion, but there's also some discussions on prostate cancer survivorship, where we have individuals who are prostate cancer survivors and share their personal stories and their journeys. And I think you will find that very worthwhile. And also, we hope that you'll become more involved with all of our activities as we move forward into 2023. And we hold many of our events looking forward into June, which is Men's Health Month and celebrated globally. I'd like to thank our sponsors, Blue Earth Diagnostics, Neil King Physical Therapy, Trinity Health, Beaumont Health, Barbara Ann Carmano's Cancer Institute, and the American Cancer Society. We hope you think forward about next year, Men's Health Week in 2023. We'll be celebrating by kicking off with Blue Monday Men's Health, not only here, but across the country with our partners at Solaris Health. Cogs and Kegs will also be on June 12th. That's a bike ride event at Griffin Claw in Birmingham, Michigan, for those of you who are local to the Michigan area. And our Run for the Ribbon for prostate cancer survivorship on June 18th at the Detroit Zoo. Each and every year, we celebrate survivorship for men and their families, and doing it for Dad. And lastly, our Men's Health event, whose date will only be determined by the Detroit Lions schedule, so we have to wait. And I want to thank all of you for participating in tonight's event. Thank you so much, and be well, stay healthy.